Hello guys, so now we shall be discussing regarding the herpes virus, right? The next group of herpes virus, that is human herpes virus 6. So we shall be discussing regarding human herpes virus number 6, right? So what is the other name for this, guys? The other name for this human herpes virus 6 is also called as sixth disease. It is also called as sixth disease. Sixth disease. So let us discuss what is this HHV-6 and the important things regarding this. The first important thing is that I have already told you during the discussion of herpes viruses, the introductory part, that all of these, okay, all of these herpes viruses, they have got a linear DNA, right? The DNA is straight, right? It is not coiled, it is a linear DNA. And moreover, this DNA is double stranded, okay? And the third important thing, it is enveloped. So what did I just tell you? I told you that it has got a linear DNA, the DNA is straight, right? And by the way, it is having two strands, yeah? So it is double stranded DNA. And this DNA is encircled in this way. It means this DNA is enveloped. Okay, so what are the things you need to write here? This is a double stranded DNA, okay, and this DNA is linear. This DNA is linear and it is enveloped, not circular DNA, it is a linear DNA and it is enveloped. So these are the important things which you need to know. First important thing, and this is applicable for all herpes viruses. Let me make a note. Applicable for all herpes viruses. Applicable for all herpes viruses. Next important thing is that how this disease gets transmitted. So how this disease gets transmitted is, it is mainly through the respiratory droplets. Respiratory droplets or respiratory secretions, okay. Now, what are the diseases? Obviously, these diseases are mainly seen in children, the infant age group also, okay. So, mostly in the infants and in the children, you see these diseases. So, this human herpes virus 6 is said to cause what kind of diseases? So, let me write a side note. What are the diseases that it is going to cause? There are many of them, but mainly this HHV-6 is responsible for causing something called as Roseola Infantum, okay. It causes Roseola Infantum. So what is the other name? It is also called as Exanthem Subitum. It is also called Exanthem Subitum, okay. So you call it as Roseola Infantum or Exanthem Subitum or the sixth disease, as I told you. Now, in under what conditions are we going to get this Roseola Infantum? I mean, are the children or the infants going to get this Roseola Infantum? Infantum in the sense the infants. So I think this disease mainly affects your infants, right? So under which conditions Roseola infants affects the infant age group? So we have to discuss regarding the risk factors. So what are the risk factors? What are the risk factors? The risk factors are, I told you, any disease, for any disease it might be, the most important risk factor will be immunocompromised state. Okay, so the first risk factor will be immunocompromised state, that is immune suppression. Immune suppression. The second important risk factor will be transplantation. Why transplantation? Why transplantation is that, for example, let us say I have got third stage liver cirrhosis. Now, it is a reversible or a irreversible injury. Obviously, it is an irreversible injury. You cannot reverse it. So, in that cases, either I die or the second option is liver transplantation. So, one of you have given a new liver to me, a liver tissue to me. Now, I know that is a healthy liver, but my body knows that is something foreign. So what will happen is that the moment you transplant your liver into me, then my body's immune system, my body's antibodies, all of them, they start attacking that liver. Okay, and this is called as organ rejection. Okay, so to prevent that organ rejection, I have to decrease the or lower the activity of my immune system. So that is the reason why after any kind of organ transplantation, you give high dose corticosteroids to the patient for a long time. Why? Because corticosteroids are responsible to reduce the activity of immune system, because corticosteroids are immunosuppressants. Okay, so they decrease the activity of immune system. As a result, the immunity will not fight against the foreign body. Now, for example, as I told you that let us say I am the recipient, I am a transplant recipient. It means I am taking a new organ from you, that is a liver. The moment I take, obviously doctors start giving me medications, that is high dose corticosteroids. Now as high dose corticosteroids are given, my immunity will be low. My immune attack on the new organ will be low. My immune activity will be low. So that is the time for this human herpes virus 6 to attack your body. Okay, so this is a risk factor. Immune suppression or the transplant is a risk factor for this HHV-6 to affect your body. So these are the mainly two important risk factors which you need to know. There are multiple of them, but these are the most important risk factors. Now let us discuss the pathogenesis of how this disease progresses. Okay, starting from the respiratory droplets entering into your body and what happens. Let me draw the lateral side of the face. Right. Now, let us say that there are few respiratory droplets over here. Okay, there are few respiratory droplets. Now, within these respiratory droplets, you see some virus particles also. So, this is a human herpes virus 6, let us say. Now, this virus particle, obviously it enters through the respiratory system. The moment it enters into your respiratory system, right now what has happened is that the virus particles are right now in your body. So these are the virus particles which are in your body. Let me make a note of this. These are HHV-6 particles. Okay, they are in your body. The moment these virus particles are in your body, within your nose, within your skin, within your lungs, stomach or intestine, in all these places which I have mentioned, okay, skin, nose, stomach, intestine, lungs, so within all these things, there are some cells called as dendritic cells. Okay, so now what will happen is that, let me draw one dendritic cell and show it to you. So let us say that this is the dendritic cell. This is a dendritic cell because it has got dendrites all over its body, right? Now on the surface of your dendritic cell, you have got something called as a receptor. Now what will happen is that this virus particle starts attaching to this receptor. Now this dendritic cell, let me make a note here, this is your dendritic cell. Dendritic cell. This dendritic cell is also given another name, that is called as APC. APC means antigen presenting cell. Antigen presenting cell. And let us also make another note that where are these dendritic cells found, guys? I have already told you that dendritic cells are seen on the skin, on the nose, right, within your lungs, and let us say it is also seen in the stomach as well as intestine. Stomach as well as intestine. So in all these places you see such dendritic cells. Fine. Now once these dendritic cells receptors are attached with this HHV virus particle, now what will happen is that, look here very carefully, this dendritic cell will move all the way down, it will move all the way down and go to lymph node. And go to what? Go to a special structure that is called as lymph node. So this is your lymph node. This is your lymph node. Let us say that within your lymph nodes you have got T cells, that is CD4 positive T cells. Okay. So let me draw one thing. So this is your CD4 positive T cells which has got its own receptor like this. Now what is this? CD4 positive T cell. It has got its own receptor. Now the dendritic cell has to come all the way here, right? So this was your dendritic cell like this. Now this is your dendritic cell which has got dendrites all over its body like this, right? Now even dendritic cell is carrying what? Dendritic cell is carrying this antigen, I mean the virus. So this is the virus. So this dendritic cell, why it is called as antigen presenting cell is that it is presenting this virus to the CD4 T cell. And now what will happen is that this virus will very easily enter into the CD4 T cell. Look here. Now the virus has entered into the CD4 T cell. Once the virus enters into the CD4 T cell, it will damage and kill down the CD4 T cells. What it will do? Now it will damage CD4 T cells. It will damage the CD4 T cells. Okay. Now after damaging the CD4 T cells, where will this virus go? Now this virus from here, after damaging the CD4 T cells like this, after damaging the CD4 T cells, what will happen is that these viral particles go to a special place and rest there. Rest in the sense they undergo dormancy. They become dormant for a certain period of time. Now where do they go? Either they can go to monocytes. Mainly they go to monocytes, right? But they can also go to macrophages. They can also go to the astrocytes, star-shaped cells, and finally they can go to the glial cells. So they can go to all these places. And what will happen? They undergo dormancy there. They become dormant at these places. They sleep. They don't cause any kind of infection. But the moment your immune system is weak, the moment this virus notices that your immune system is becoming weak, again they'll wake up from this dormancy state and they start attacking your body. Okay? And it is also said in some of the books that this virus also replicates in your salivary gland. So just make a note of that. This virus also replicates in salivary gland. Are there any vaccines available? No. HHV-6 has got no vaccines. Right, let us look at the symptomatology of the patient. What are the symptoms the patient would basically complain? Now, the symptoms are, there will be very high fever for 3 days. Okay, so there will be high fever for 3 days. Okay, and along with the fever, there will also be seizures. Febrile seizures. Now once the fever has disappeared, for example, when the symptoms of the fever resolve, after fever the next stage will be rash formation. Okay, there will be light pink rashes which are also called as mobiliform rashes, light pink, that will be developed on the trunk. Okay, so I'll show you the picture anyways. There will be light pink morbilliform rash. Light pink morbilliform rash developed immediately after the fever. And obviously within 2 to 3 days even this rash will fade away. that's not an issue. Along with the rash, you will also see another important thing. You will see erythematous spots, some red color spots, guys, some red color spots you would see on the oral cavity, within the tonsillar region, within the pharyngeal region. When you open the mouth, on the tonsillar region, you will see some bright red color spots. Okay, so what I am telling is that there will be some erythematous papules. Okay, where do you see? On the mucosa of soft palate. On the mucosa of the soft palate. So when they open the mouth, here we have got the hard palate, and back of the hard palate we have got the soft palate. On the soft palate you would see some bright red color spots, and these are called as Nagayama spots. What are these spots called? These spots are called as Nagayama spots. Okay, so let me show it to you. Let me show the picture. You see these bright red color spots over here, right? You can very clearly see some bright red color spots, right? So these spots on the soft palate are called as Nagayama spots. And next important thing is that you can see the rash which is developed here. This is called as Roseola Infantum. Okay, so what will be the treatment? There is no much treatment for this. The treatment is always supportive care. Supportive care in the sense the symptomatology. For example, if there is fever, you give let us say fever medications, right? If there is pain, you give pain medications, and obviously you need to give in case of fever there will be dehydration, so you need to give lots of fluids to the baby. So all this is the supportive care. Okay, and the symptoms will resolve immediately. So this is all you need to know regarding the human herpes virus 6. Thank you so much for watching my video. Goodbye.